Compared to knee or hip arthritis, osteoarthritis of the wrist is much less common. In this video, I'll explain some of the injuries that military service members frequently suffer that can lead to long-term wrist osteoarthritis. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Osteoarthritis is a chronic, non-inflammatory joint disease characterized by degeneration of the articular cartilage. I've done a number of videos about knee and hip and shoulder osteoarthritis. This is a similar process. At the wrist, osteoarthritis is usually secondary to trauma and a traumatic injury. It can, though, result from inflammatory joint diseases, metabolic bone diseases as well. Not really going to talk about that much here. The main injuries responsible for wrist osteoarthritis are ligament lesions that impact or damage the cohesion of the first row of carpal bones, these bones along this aspect of your wrist and hand. The scaphoid would be one of those, and dissociative instabilities of the scaphoid and those bones, non-union of those areas, instability of the first row of carpal bones, all can cause collapse of those bones, instability, and a secondary osteoarthritis. I'll do another video in coming weeks about non-union of the scaphoid and things like scapholunate advanced collapse, things like that. Non-union of a scaphoid fracture is a common cause of wrist arthritis. It typically leads to arthritis within about 5 to 10 years of a scaphoid injury. And again, that's known as scaphoid non-union advanced collapsed wrist. Radiocarpal osteoarthritis is a consequence of distal radius fractures, fractures of the wrist when you fall, say, on an outstretched hand, especially if it doesn't line up well. What we call a malunion gets to basically an uneven or not smooth joint surface, leading to osteoarthritis of the radiocarpal joint, part of the wrist. And that can happen even if you undergo a reduction where the orthopedic surgeon puts it back in place. And even sometimes after a surgery, sometimes you can get that. Osteoarthritis of the wrist is not super common, but if you get a fracture that goes into that wrist joint, it can happen. If you get an injury to those carpal bones or instability, damage to the ligament of those carpal bones, wrist osteoarthritis can definitely happen. Now, if you have ideas for future videos for this channel, injuries, risk factors for injuries, the Nexus letter, DBQ process, anything like that, leave those in the comments below this video. Please subscribe to this channel, click the bell to be notified when I release a new video. And if you're interested in a Nexus letter for your injury or condition, click the link in the description below. You can learn more about working with me and working with my team. We do everything we can to make the process simple, to make it quick, and I really try hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks so much for watching, and I look forward to helping you more.